Hi, this is Dr. Francis Price, and I'm going to talk about Descemet's membrane endothelial keratoplasty. This is a procedure where we're just going to transplant the inner layer of the cornea. That's about 15 to 20 microns thick. We've measured the diameter of the eye, then chosen the trephine that we want to use to delineate the size of the donor. And we've marked the surface of the cornea, not cut it, but just mark the skin covering, the epithelium. And we've done that to outline the area that we want to remove the diseased area of Descemet's membrane and endothelium. Usually when we're doing these surgeries, it's for Fuchs dystrophy. So we just injected some anesthetic into the eye. Otherwise, we're just using eye drops for this surgery so the patient can see to some degree what we're doing. We've put air in the anterior chamber, and that's to give us good contrast. It really gives us the best contrast of anything to see what we're doing when we break this membrane all the way around. This is a blunt dissector, a Price Sinskey hook. And then once we do that, we're going to use the hook to catch the edge that we scored and pull it off the back of the cornea. This needs to be done very carefully so we don't scar or damage the back of the cornea. Now we're going to remove that membrane. And this membrane is where the disease with Fuchs dystrophy is. It has little bumps on it that diffract the light and distort vision. We put in a blue dye, trypan blue or vision blue, and that will stain any remaining areas of the membrane that were dislodged but not actually removed from the eye. So we have two instruments in the eye. One is putting fluid in the eye to keep it formed, and the other was to aspirate out the extra membrane. And then we went in with a small scissors and made a hole in the colored part of the eye. And we do that to prevent glaucoma after surgery. Now what we've done here is the donor cornea that we've stripped off the back of a donated eye, just like we removed it from the patient's eye. We've cut it with a trephine, the same one we marked the patient's eye with, to the desired diameter. And we put the blue dye on it as well so that we can actually see it when we place it in the patient's eye. Now we're going to insert it in the eye using the same device that we would use with cataract surgery to place an intraocular lens in the eye. So we're going to inject it in here. And then once we have it inside of the eye, we're going to place a suture here to close the incision and make it less likely for this donor tissue to pop out while we're manipulating it to get it to unfold. Now we have a cannula in the eye, and this is injecting short bursts of balanced salt solution, and we're going to get the tissue to unfold. Once we get it to unfold, we have to determine which way it's curled. One side has the endothelial cells on it, and the other side has Descemet's membrane. And we want to end up so that the endothelial cells are pointed towards the iris, the colored part of the eye, and Descemet's membrane is pointed up towards the part of the patient's cornea. Once we've determined which way it's curled, then we put an air bubble underneath the donor, get the donor to unfold, and then we're going to stroke the cornea here, moving the donor into place. Now during this time, the blue dye has been diffusing out of the donor, so it gets a little bit harder to see. But you can get the idea that it has gone into the area that we marked and stripped earlier, removing the patient's Descemet's membrane. So we're now going to fill the anterior chamber with air and that actually pushes the new donor up against the back of the patient's cornea. And so it will stick in place, and we basically removed the patient's diseased endothelium and replaced it with some new. Thank you.